Hey, this is Dr. Bonebreak, and this is Daniel. He had a lot of problems when he first came in. Daniel, could you elaborate?
Well, I came in with a frozen shoulder that occurred after a torn labrum surgery. Um, Weeks, months of physical therapy, and I could barely raise it 30 degrees. After a couple weeks with Dr. Bonebreak and excruciating pain, I could get it up over my head, and after more work with him, it's stronger and better than the other one. So
And what do you do for a living?
I'm a mechanic, which, as you can imagine, it helps be able to raise your arm above your head.
Okay, and we use T-TAPS Part 2 to help Daniel out. This is Dr. Bonebreak, and here we have Tim. He came in with some pretty horrendous problems.
About 20 something years ago, I'd been involved in a major car accident and ended up developing sleep apnea. Um, had major surgery done for it, and the doctors explained that it was a good possibility and a likelihood that my throat would close back up in time. And 20 something years later, I started what I thought was falling asleep in the afternoons. And I actually fell asleep one day in a dentist chair while having a tooth drilled. The dentist actually intercepted me at the car before I left and brought me back in and took x-rays because she was concerned that saying that nobody falls asleep, having a tooth drilled. She took some x-rays and showed me where my air passageways in my throat compared to another patient where they looked like about the size of two quarters overlapped in a figure eight. Mine looked like a single quarter laying on end, which was pretty serious, and she said that I was basically going to die if I didn't have more surgery. Did follow up with the surgeon at a later date. He said I stood a 50-50 chance of losing my voice box. As things pursued, I ended up with seeing Dr. Bonebreak when he said that he could handle it, and after 2 treatments, the problem was gone. A year later, when I saw the same dentist, she thought she couldn't believe I was still alive without surgery, and she took another x-ray, and it was normal.
And this was done with T-TAPS Part 2.